Chapter 2, Quality Assurance and Legal Issues in Healthcare. Quality is the degree of excellence in something, and quality assurance is all the activities and programs put in place to guarantee the excellence of patient care. Patient care is our highest priority. We want to make sure that we are providing excellent patient care to every patient. The Joint Commission, or the TJC, establishes standards for the operation of hospitals or health-related services and facilities. The mission of the Joint Commission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Patient safety and Sentinel events. So a Sentinel event is any unfavorable event that is unexpected and results in death or serious physical or psychological injury. Example, loss of a limb or any of its function, death, things like that. The Sentinel or early warning event policy is to help HCOs or healthcare organizations identify significant safety issues and take steps to prevent them from happening again. So when a Sentinel event occurs, there is a policy in place that says that we launch an investigation into what happened, why it happened, how we can prevent it from happening, and then we implement new procedures in place that prevent these things from happening again. If a Sentinel event occurs, the healthcare organization is required to perform a thorough and credible analysis of the root cause, develop an action plan, implement improvements to reduce risk into practice, and then monitor those improvements to determine that they are effective in keeping a Sentinel event from occurring again. National Patient Safety Goals, or NPSGs, are used to promote and enforce major changes related to patient safety. The biggest way that we can do this regarding patient safety as phlebotomists are to identify the patient correctly. That's step number 1. Okay, we want to make sure that we are always identifying the patient using 2 or more identifiers, which is, at the very least, their name and their date of birth. First and last name, date of birth. And then if, for example, because it can happen, you have patients, 2 patients with the same name, you'll get a name warning that tells you that there are 2 patients in the hospital or wherever with the same name. And this is when you would compare the names to the dates of births to the patient record number or the patient ID number or the MRN, medical record number. Okay, just to determine that you are in fact drawing blood from the correct person. The next thing that we can do regarding patient safety is to label the specimen in front of the patient or in the patient room. We always want to make sure that before we leave any room, we have a labeled specimen from the person that we just drew the blood from. That way we don't have empty or unlabeled tubes on our carrying tray or in our pockets that we are unable to identify later. Okay, maybe you forget about it and you think back to, oh my goodness, which patient was I with when I drew this blood? If you already have it labeled, then you will not run into the issue where you're trying to remember what patient you drew it from and potentially having to redraw someone. The objective is to reliably identify the individual and match the service or treatment to him or her. If we don't label the patient's blood in front of the patient or in the patient room, we can also run the risk of labeling blood samples incorrectly and therefore getting incorrect results and incorrect information to patients, or incorrect results for patients and giving the incorrect information to the patients. Okay, this means that they get the wrong treatment, and depending on what the issues are, this can be really detrimental or harmful to their care. We want to make sure that we improve staff communication so that we can get important critical tests and diagnostic procedure results to the right staff at the right time. Okay, this goes back to our communication from chapter 1, making sure that if we have stat labs, we're collecting those first, we're getting them to the lab, getting them tested, and then getting the results reported to the nurse or the doctor who's asked for them. Okay. Preventing infection by using current hand hygiene guidelines from the CDC or World Health Organization. Set goals for improving hand hygiene and implement them. The objective is to reduce transmission of infectious agents from staff to patients and decrease healthcare associated infections, HAIs. That's an abbreviation you need to know. Okay, healthcare associated infections. And the best way to do this is washing your hands after you eat, before you eat, after you go to the bathroom, in and out of patient rooms. If you don't have hand washing station, hand sanitize. It's going to be very important to hand sanitize in and out of patient rooms after you take gloves off, before you put gloves on. Okay, we're constantly washing hands, we're constantly hand sanitizing just to make sure that we can prevent infection. Additional agencies, which we've kind of already talked about a couple of these, but the Institution for Healthcare Improvement works with countries, regions, organizations, and individuals to build safety into every system of care to ensure that patients receive the safest, most reliable care throughout the healthcare industry. Safe, reliable care. We want to provide excellent patient care, high quality patient care. Clinical Laboratory Improvement Amendments of 1988, or CLIA 88, is a federal regulation that establishes quality standards and applies to all facilities with the aim to ensure accuracy, consistency, and reliability regardless of location, size, and type of lab. All labs run the same diagnostic tests in the same ways for consistency, reliability, and accuracy that can be transferred. Okay, so one hospital can run a test, send it to another hospital, and that hospital can look at it and say, okay, I know what this says. Quality assurance in phlebotomy. Okay, there are a couple different things we can do for quality assurance. QA processes are appropriate process improvement techniques to identify problems or inadequacies and make changes to prevent errors. Quality indicators are a measurement or value that provide information on the effectiveness or quality of processes. Thresholds in data, or a threshold value, is a level of acceptable practice beyond which quality patient care cannot be assured. Processes and outcomes are following processes from start to finish to monitor the outcome and ensure the same process is always followed. And quality control is the use of checks and controls to assure quality. I know that's a lot of information on one page, okay, but get familiar with quality assurance. The easiest way that we can implement quality assurance is in our patient preparation procedures. To obtain a quality specimen, the patient must be prepared properly. This means that we're going into the room, describing what we're going to be doing, the procedure, what we need, right? We are introducing ourselves, making ourselves known, stating our intentions from chapter 1, establishing a rapport, and then asking the patient, can I take blood? I'm here to take blood. Is that okay? Yes. Okay, great. We have our consent. Now, when we prepare the patient, we're moving into our procedural preparedness now, which is cleaning the arm, okay, and making sure that we're following our procedure for cleaning, and then following our procedure for specimen collection. Identification. This is the most critical step. We're identifying with at least 2 identifiers, first, last name, and date of birth, then MRN number, never room number, ever, never ever room number. We're making sure that we're using the correct puncture devices. Ensuring the quality and sterility of every needle and lancet is essential for patient safety. They're single use only in a package. If you have a package that's broken, or a seal that's broken, or you've previously assembled your needles, that's a no-no, okay? Everything needs to be sterile, single use, to ensure quality and sterility of every needle. Evacuated tubes, checking their expiration dates and disposing of any outdated tubes, making sure the seals aren't broken. Labeling. The labeling must be exact. Make sure you're labeling in the patient room, in front of the patient, as to avoid any mislabeling accidents. Then our technique. Maintain the standards of good technique to ensure high quality specimens. Make sure you are following your venipuncture procedures, which we haven't learned yet, but we will. Following venipuncture procedures to the T, making sure you're pulling everything in the order of draw. And then recognizing which specimen request is the most critical, or when a specimen involves special collection criteria. Okay, so is it a stat test? Does it need to be placed on ice after collection? Does it need to be walked to the lab rather than sent through the tube system? Does the tube need to be preheated? Does it need to be drawn into a special color? So on and so forth. We'll learn all of that as well. And then we have what's called delta checks, which compare current results of laboratory tests with previous results for the same test on the same patient. So we draw a test on a patient, we run the results, then we take another test on the patient, maybe the next day or even a couple of hours later, run those results and then compare the two. This can be done throughout the whole entire day with multiple test results or just 1, 2, or 3. It just kind of depends on what they're testing for and what they're wanting to monitor. Documentation is very important. Documentation is critical in all areas of healthcare. Medical errors due to wrong information are prevalent and sometimes deadly. The patient record is a chronological documentation of the medical care given. For phlebotomists, in the healthcare setting, so specifically for hospitals, when you're working with patients who have a patient medical record, everything is electronically recorded now. So, for example, you go into a room and you have a little scanning device that scans the patient wristband, you double check their name and date of birth, draw their blood. It shows what time you scanned their wristband, what time you printed their labels, what time you collected their blood sample, and it's all chronologically ordered with an electronic signature of your initials and like your employee ID number. So it shows who goes in and provides care, and it's the same with the nursing staff as well. And also the nursing staff is trained to like put their initials and stuff next to any procedure that they do and that they chart, just to maintain a chronological order of things done, who did it and when. Along with that, the reason for this is just to make sure that if something happens or an intervention is done incorrectly and something happens or there's a sentinel event, it can be traced back to what happened in the investigation, right? So who did what caused this, who did this or that kind of thing. Moving into legal issues in healthcare, the big one is sexual harassment, which is persistent or offensive conduct related to a person's sex that negatively affects a person's job. Now, sexual harassment is a huge deal. There's no reason why there should be sexual harassment in the workplace. If there is and it happens to you, please report it. And I'd hope that if you are the one sexually harassing someone else, that they would report you as well. So we all know that sexual harassment is absolutely a terrible thing and it has no place anywhere. So just keep in mind the way you interact with people, the way that you talk to people, and just maintain professionalism. Try to keep inappropriate conversations and comments out of the workplace. Just remember that we're in a professional environment where you need to treat others and also maintain a amount of respect for your own job and yourself. Tort is a wrongful act committed against someone's person, property, reputation, or other legally protected right. These include assault, battery, breach of confidentiality, fraud, invasion of privacy, malpractice, and negligence. Just make sure, and these are all going to be outlined in a specific employee policy handbook, okay? They're all outlined in the employee policies at most places, excuse me. Just remember, we're in a professional setting. We should be acting with integrity and following our ethical conduct. You can be charged with assault and battery, malpractice and negligence, all of these based on the severity of the incident, and just be prepared for that. Pay attention to the way that you treat people. Again, the same thing goes with sexual harassment. Just pay attention to the way that you're treating employees, so other employees. the way that you're speaking to patients, the way that you're treating patients. Just remember, you are putting your hands on people and you are protected to some degree, okay? But if things escalate and things get out of hand, there can be certain situations where you can be charged with tort. Just keep that in mind, okay? It doesn't happen every day, but it can happen. Oops, wrong way. Patient consent, we talked about a little bit. Patient consent is very important. Informed consent is voluntary and competent permission for a medical procedure, test, or medication. When I walk into a room and I say, hi, my name is Samantha, I'm here to take a blood sample, is that okay? The patient knows who I am, what I came to do. They say yes or no, but they say yes to me and I am then allowed to take a blood sample. That is informed consent. They've given me the consent based off of the information I've given them. Expressed consent is a variation of informed consent, usually for surgeries, experimental drugs, genetic testing, or high-risk procedures. This can be written and verbal. Usually it is written and verbal, right? So if you're going to go in for a surgery, they have you sign all of these documents saying that you have consented to this procedure, you know exactly what the terms and conditions are, you know exactly what the side effects of things are, or what like the negative outcomes could be. And you give your written and verbal consent for this procedure or this experimental drug or testing or whatever, surgery, whatever it is, whatever it may be, you give your consent for it based on all the information that you receive, and then they just have your signature on it just in case anything happens. Implied consent is the patient's actions or circumstances imply consent. A good example of this would be if someone needs CPR. You can't wait for them to wake up to ask them if they need CPR, okay? Or if you can administer CPR. If they need CPR, they need CPR, you're just gonna do it, right? And the same implied consent for us, a good example for phlebotomy, would be you come into a room early in the morning or late at night and you say, hi, my name is Samantha, I'm here from the lab, I need to take a blood sample, is that okay? And they don't say anything or consent to you verbally, but they hold their arm out like this. Okay, that is a good indication to me that they heard what I'm saying and they are extending their arm, they're giving me consent. It's implied even though they didn't say, yes, go ahead. I would like to just add in to this that if at any time, because sometimes people can be confused or maybe they misheard you, if at any time after they have given consent, they take it away, that's okay. Don't fight them on it, just say, okay, great, I'll let your nurse know. Okay, they are allowed to refuse at any point, even after they've given consent already. Okay, just so everybody knows. Consent for minors. A minor cannot give consent. This is under 18 years old. A parent or guardian consent is required. Okay, so anytime you go into a room of like a pediatric patient, the mom or dad will have the band on, the identification band. The kid will have a matching on their wrist or their leg. And so you ask mom or dad consent. Hi, I'm here from the lab. Same as always. I'm here from the lab. May I take blood? A refusal of consent is any individual that refuses treatment for any reason. They must sign a documentation of refusal form. We don't provide this, but the patients have the right to refuse at any time. We need to be respectful of this as it is their right. What we do in this situation, if I go into a room and I ask if I can take blood and someone says no, I would say, okay, no problem. I will let your nurse know that you are refusing. I go out, talk to the nurse, and sometimes the nurse will just say, okay, try back later. Or they will go in and they will try to talk to the patient and just say, hey, we really need this blood and this is the reason. And then usually the patient will let you do it. But sometimes they stand firm in their no, and that's okay. You just let the nurse know and the nurse will give them their refusal form. And they'll let the doctor know as well.